Thank you, Nandini. I hope Lawrence was saying we should answer all these questions, but uh, I don't think I'm expected to do that because it will be in my. These are very important questions, by the way, and I hope some of them are already included in my keynote, so I will be excused. Um, First of all, I would like to say good morning to everyone. And it's really a great pleasure to be here today and to be addressing such a distinguished audience. Let me start by expressing my deep appreciation to all at the Center for Global Development. Special thanks go to CGD President Dr. Nancy Birdsall, who is not here to join us because of other very important issues, private. And also I would like to thank Dr. Lawrence MacDonald, Vice President of Communications and Policy Outreach, who I understand will be serving as moderator of this session, and to Dr. Nandini Oman and her team for organizing this special event and inviting me to say a few opening words. I'm very pleased to have this opportunity to interact with distinguished academics and researchers from Mozambique, Uganda, and Zambia, as well as key officials from lead US government agencies engaged in international development, and to share some thoughts on a notion that has become the subject of so many conversations around the world, especially in recent years, which is the concept of country ownership. With the global community's renewed commitment to advancing aid effectiveness, country ownership has emerged as an integral feature of the new paradigm of results-oriented and partnership-based development that we have seen evolving over the past decade. So what exactly do we mean by country ownership? And why is it desirable? We all talk about country ownership in different contexts, but do we have a common understanding of it? I think we all agree that there is today a wide diversity of perspectives on this subject, and the main aim of our distinguished panelists today is to reflect on the experiences of US-led initiatives in particular, and distill some of the lessons learned with a view to informing current policy making. I must say that I am really excited that this concept of country ownership is getting increased attention, as I happen to believe that there is simply no other way for developing countries to chart and take charge of their own course of development and overcome the many challenges they face in building effective and productive states. Drawing on some of our practical experiences in Ethiopia, my country, I would like to share with you today a few thoughts on what country ownership has come to mean to us. Of course, I will not tell you the definition. I like the Napoleon Hill book, which doesn't tell you the formula, but encourages you to find the formula for success in the book that he wrote. I don't know if you have, for some of you who have read the book. So I will not define it, but I hope you will get it in what I will say. But I would like to start by briefly highlighting four interrelated ingredients, which I believe have been key to promoting country ownership and consolidating commitment on the countryside. I will then talk about the development partners can do. Of course, it will be mixed with what I will say. First, I would like to start with a person called Willem Buter. This is in his 2004 article. He was working for the World Bank, I think, at the time for Europe. And in his article was putting some of the opinions of people on country ownership. And I found it really interesting. So I will start by direct quoting what he said or what he got from people. Some people say country ownership is it's about country's own design or country's needs. And others say it's about country's significant involvement in the planning. And a third group said it's about authorities were informed. Can you see the range? From owning, that's planning, to authorities were informed. This is about the planning. And then when you come to implementation, there were three views again. The country implements the program. the country plays a significant role in the implementation. And this is the second one. The third is the country authorities are kept informed. And some people think that this is country ownership. So you can see the, various or extreme views about country ownership. And people say it's really complicated. But I would like to outline it in a routine planning process and see what country ownership would mean following that process. The number one is, as many of you, and as I said earlier, regarding the Will and Bitter's opinion, planning is very important, or planning that starts from vision. So a country should have a vision. When we say about country ownership, the country should have not only a vision, but should have practical steps to realize its vision. This could be explained in terms of policy. So it means the country should own its policy. So it has many components in it. For instance, in Ethiopia, we have set a plan saying for our country, in 15 to 20 years, we said Ethiopia should be one of the middle income countries. That's what we want to achieve. And we try to put down strategies on how to get there. And we also believe that we know how to get there. Not only we have this vision, or we know where we would like to be, but we also try to see or try to outline how we could be there. So when I say country ownership, then, in relation to what I said, it starts with knowing what you want. It could be a wish list. It could be a laundry list, even, if you like. But do we know where we would like to be? Do we know how do we get there? Does the country really outline that? I think that's the first step, even to negotiate with partners on what should be done about the plan. Then, if the country has this, for country ownership to really be realized, on the partner side, the partners should accept that plan, should accept that vision, should accept that dream. I'm not saying the country shouldn't listen to suggestions or recommendations. It should. By the way, when we designed this, strategy, so many strategies we have, we tried to learn from our neighbors. We tried to learn from countries in our continent, from the East, West, South. And we tried to learn from Europe, from the US, from Asia. I think we should be open to ideas. But if we think that what we're proposing for our development is better than what's being suggested, then we can keep ours. So that's what I'm saying. After negotiation, after debate, after dialogue, if we still believe that, and after probably revising it because we find some of the ideas attractive, then still that plan should be accepted. I think that's the first step towards, real ownership. I will give you one example. I read it in one article, which I don't remember. I couldn't find it. Plan means where you would like to go. Some people say, as you know, in that article I read, put the country in the driver's seat. But if you're in the driver's seat, but you're not the one who decides where to go, then you're not taking the responsibility. You're not controlling it. You're as well as, a chauffeur. That's it. So when we say driver's seat, then you should be the one who should decide where to be, where to go. Of course, you should listen to people because that road could be dangerous. If you're convinced, you take it. If you're not convinced, you take yours, and you may even take risk. So partners, on the other hand, then should really respect to that. If it's really putting in the driver's seat, as I read in that article, not only being in the driver's seat, but I should be the one who should decide where to take that vehicle or that aircraft or whatever aircraft or, machine I have at hand. So there are two elements here. We should rally around a country's plan, its own vision, dream, because commitment comes from there. And at the same time, partners should really accept that and try to support that one. And in Ethiopia, that's what we're trying to do. As I said earlier, we have a vision, we have strategies, we have steps already designed to get where we would like to be. And this is the first step. And then the second is, after having the plan, follows the resourcing. So if it's going to be resourced, then again, the country should really decide on how to resource. Resource is not enough. There is scarcity, so you do prioritization. So in the plan, you may have prioritization. For instance, in Ethiopia, what we normally do is we prepare Plan A and Plan B. Plan A is the very ambitious one. But if we're not able to really achieve that because of resource constraint and so on, we try to have a safety valve, which is Plan B. And we still prefer to take the responsibility of prioritization, because that's linked with the planning. Because plan without prioritization and prioritized activities, if not resourced, I don't think you can start implementation. In resourcing, I think the most important element here is the kind of funding you get can affect, of course, not only when I say resourcing, it can affect the planning, the whole planning process. When I say the kind of funding you get, if you ask me, the most ideal way of financing developing countries is budget support. So if countries would be able to get budget support, since the plan is theirs, based on their prioritization, they can fund their plan. They can have, the plan is, let's say, a formula, and then the resource is a fuel that can really realize or translate what is in the plan into reality. So that's very important element of ownership, by the way. If there is commitment, I think, to country ownership, I'm being candid today, there is no alternative even to budget support. That's the best arrangement that could ever be, or the best modality, because it gives the country full ownership and use the resources on how it fits best to achieve the targets or whatever it's trying to achieve. So it's in its hands. How do I use the resource? You know, where do I allocate more? Where do I allocate less? Or where do I allocate even none whatsoever? So that should be the most important element of country ownership. Or some people say, okay, partners have, you know, it's like a wide spectrum. We shouldn't expect partners to behave same way, same day. So some argue that, okay, let's forget about budget support, but how about less earmarking? Or let's forget about less earmarking. What about if as long as the plan comes from the country, if we find out some countries who want to specifically finance some specific areas, why not? It's still fine. And in Ethiopia, that's what we do. We cannot expect, you know, different countries behave same way, because there are so many reasons that makes it that way. Then we put the spectrum. But still, we try to use whichever way we get the money, to use it based on our plan, the plan I told you on how to get there. But if you ask me from 3 or 4 options that I may have in terms of architecture in financing, I would go for budget support, because it empowers me, because it empowers the country, because it really gives it the responsibility to really say what it wants. So country ownership is about who chooses. Then I choose to resource this and that and that. So resourcing is very important. But as I said, there is a broad spectrum. I can give you one example in Ethiopia, for instance. Even vertically raised funds, we use it horizontally or diagonally. I think a Mexican scientist said about this vertical and diagonal, horizontal. We use it in action. Global fund money, PEPFAR money, it's vertical. But we're strengthening our health systems. The HMIS, brand new health management information system, was funded from PEPFAR and global fund money. logistics pharmaceutical finance supply system, a brand new one, which takes so many years to build. Anyway, we have already started building it. Came from Global Fund and PEPFAR funding and other vertical programs. And I can give you a long list. Human resources, something that came vertical was used horizontal or diagonal. Why? At least if the funding mechanism is not like budget support, then we try to negotiate with partners in a way to use that to benefit the whole health system. Use it diagonally and horizontally, meaning based on our plan. Because in our plan, we stated clearly that we cannot achieve results unless we try to invest in our health system in an integrated fashion. That's the best way forward. So that's why we try to use the vertically raised funds to use it diagonally, horizontally. HIV money, for instance, we're using it for maternal and child health, building health centers, expanding them, equipping them, mining them. So still, if it might less, okay, it may not be direct budget support, but at least you can again negotiate and try to make use of the broad spectrum you have, because the partners cannot behave same way. But the best scenario, I again state, is budget support, which really gives full responsibility to the country. And if there is one particular option to be chosen, I think that should be the best one. Then from resourcing, then the next obvious step is you go to implementation. Then in implementation, it should be the country that should implement. There should not be parallel structure in the country. There is, for instance, parallel structure in the name of technical assistance. If there is technical assistance, the country should choose. I will tell you one example in Ethiopia, for instance. We wanted to have a new health management information system, I told you. Then we said, we need technical assistance for HMIS. We were not told, saying, take this, you need to do HMIS and you have technical assistance. We tried to choose. Even pharmaceutical finance supply system, we chose. We said, we need technical assistance. The idea here is, when you implement, you may not have capacity. But because you don't have capacity, you shouldn't be replaced. Your capacity should be boosted. It should be strengthened. So when you talk about implementation, then you may lack capacity, but because of lack of capacity, you should not be replaced, or you shouldn't have a parallel structure, but you should strengthen the same system. Use the same procedure, use the same policy, strengthen it, make it work. Make the country's system work, fix it. That should be the way we should partner. I will give you one example of Ethiopian Airlines. It's the best airliner, one of the best, of course. Not, one of the best ones, excellent service. And when it started, there was US support. Even the pilots were Americans, the managers, everything. Then gradually, they were giving technical assistance, building capacity. And in some years, I think they were out, all of them. But there was capacity there. The system was there. The human resource people who could run it. And they have run it for more than 55 years. It's more than 60 years old now. So, strengthen from inside. It can continue. If there is parallel, then whatever country mechanism we have will be weakened. Because it's people from that system that are going to migrate to the parallel structure. So what do you leave there? Nothing. So when the support expires, you leave the country with a weakened system, not a strong institution like Ethiopian Airlines. No. But Ethiopian Airlines now fully run by Ethiopians. It's working because the way it was handled from the start was the best way ever. And I give that example as the best example of partnership. Then in our case, for instance, in the health sector also, as I said earlier, when we implement, we may have lack of capacity. We do, very serious problem, but we ask for technical assistance specifically, help us on this. Then we try to take that and make it our own. Then the final one, which I would like to raise, number 4, is after implementation, the natural path is monitoring and evaluation. You track how you're performing. And that should also, the country should be able to do that. But here, there should be a results framework. And donors cannot give their money like that. They need accountability. They want to see if whatever they're giving is making sense or giving something. Delivery, say cash on delivery. Nandini was telling me, and I confused that with cash on delivery in India. When a mother delivers in an institution, she gets money, but this cash on delivery is a different thing. So this is about results. So from the outset, during the planning, we can agree. For instance, maternal mortality reduction by this, malaria, HIV prevalence by this, or poverty, $2 per day, those who get proportion of them should be this much. We can agree on the result. So donors should be, or partners, development partners, better language maybe, should really be involved on this, based on the outcome. It's not on the process, on the planning or whatever. Of course, building the capacity in that aspect is very important, but the accountability should be based on outcome that we agree. In Ethiopia, for instance, we developed a harmonization and alignment framework based on Paris Declaration, and in that results framework, we put outcome on how our partners can hold us to account, and that's the best way. And there won't be any confusion if people are asked on whether they delivered the result or not. But you empower them, whichever way they want to get that result. In Ethiopia, there is a saying, "Yetim fichu duketu namchu," means make the floor wherever you want, use a stone to make the floor or a machine or whatever, but I need the floor. The ምንድነው የሚባለው ዱቄት? Flour. Yeah, my English is. So the flour. So the end result is I need the flour of a maize or a corn or a wheat, it doesn't matter. However you do it, I need the result. So that's how it should be, the engagement, the accountability. So finally, I don't think, the four things, if there is the real ownership that goes through the four things, and which I tried to say about countries and donors, if there is true ownership, then there is commitment to that. If I own something, then I'm committed. If I am committed, result is obvious. And sustainability is also obvious. And that's what we see in Ethiopia now. We have that long-term vision. Believe it or not, the vertically raised money, PEPFAR and Global Fund, is helping us to build our health system for the future. So we're not only saving lives now. For instance, 5 years ago, we had only 900 people on HIV treatment. Now we have more than 180,000. We're saving lives. And 9 out of 10 are surviving now after taking ARV drugs, while 8 out of 10 were dying before. We're saving lives now. And we're now more than 70% now, in terms of coverage. People who need the treatment are getting it. While doing that, we're building the health system. Healthcare delivery expanded. Health extension program. Health center expansion. New health information system design. New pharmaceutical finance supply system. New health insurance. New health insurance. And human resources, at least mid and low level, is being addressed. Now our serious problem is doctors and above. And this is because we try to use the funding based on our needs. Because we're committed to that need. Because that need is ours. What we wanted to happen. So that's because that's why we have the result. And we also believe we can sustain it because we have done some system issues. What I have said today, there is nothing new. Nothing, literally. I haven't said anything new. It's there. Anyone here can say it. If you ask me candidly what's missing in terms of country ownership, there is lack of commitment. People say country ownership is confusing. No, it's not confusing. It's clear. It's clear. But what is missing is, are we really committed to implement it? I don't think so. And the reason, we have a wide range of interests that hinder us, not only to commit to country ownership, it's even sometimes very difficult to discuss candidly. If I ask for budget support, certain partner may say no, because what is the reason? No reason. No reason. But there's something uncomfortable, which cannot be said maybe openly. But there is lack of candor also, I can say, even if it's no way we cannot give you. Am I being told candidly? I don't know. I'm not. So that's another problem. So what I believe is, if there is candor and true commitment, we should continue dialogue with candor. I think the elements of country ownership are known. I don't agree with people who say country ownership is confusing. Just take from planning to resourcing to implementation to monitoring and evaluation. It's really clear who takes what. At the end of the day, it can be put, I said I will not define country ownership. To me is who has a say. That's it. Country ownership is who has a say, who makes the choice, who makes the move. That's it. Without really huge number of conditions that really tie up the whole process. Less conditions, conditions based on outcome only maybe. Then really clear road to really run and have a say when you run. Then that's, I think, to me, country ownership, who has a say. And thank you so much. And I took, I think, more than I should, but I wish good luck to the panelists. And I think I have contributed some, maybe, but as I said earlier, nothing new. But let's continue the dialogue with candor. Thank you so much.